And there's a new CEO at the helm of the Oklahoma Healthcare Authority. We are very excited to have her in studio with us today. Everyone, please welcome Ellen Bittner to the show. Ellen, thanks so much for coming on today. We really appreciate it.
Thank you for having me. I'm excited to be here.
So congratulations, first of all.
Thank you very much.
Tell me how you're feeling with this, new role here at the Healthcare Authority.
So very excited. It's been a really great couple of weeks. As you know, I've been at the agency for the past 4 years, been in state government for over 15 now, especially in the health and human services sector. And so I have the privilege of already knowing a lot of the folks that work there, some of the initiatives that we have going on. And so I'm just really grateful, really excited. Everyone's been so supportive, so happy about it.
You kind of answered my next question, but I was just going to say, tell me a little bit about yourself and your experience.
Yeah, absolutely. So I've been in public service virtually my whole career. Spent about 11 years at our State Department of Mental Health. That was where I first started out as an entry-level attorney and worked my way through that agency, learning as much as I could potentially about the people that we serve. Really fell in love with the mission of the agency and the difference that they're making. When I had the opportunity to go to the Oklahoma Healthcare Authority and work for the state's Medicaid program, where we serve over 1 million Oklahomans, that was just an opportunity that I couldn't pass up. So I've been there for 4 years, getting to know the employees there and carrying out a lot of really amazing initiatives.
Taking on this new challenge.
Yes,
okay, let's talk priorities.
Yes.
I want to know, number one, top priority, first thing in the new role, what are you going to tackle?
So really, I see my role as being there for the team. I am their support system, I'm their advocate, so really carrying out the mission of the organization. We have 2 large initiatives that we're carrying out right now. One of our biggest challenges, aside from those, is we always want to do more. We have incredible folks that do amazing work for Oklahomans across the state every single day, but we always feel like we need to be doing more. And so we're looking at ways that we can invest in quality initiatives, improving maternal health outcomes, and moving forward to improve health outcomes the best that we can.
You kind of alluded to it there, but I guess what would you say specifically are some of the biggest challenges that you're working through right now trying to tackle?
Yeah, absolutely. So one of the biggest initiatives we have right now is moving to our Sooner Select Managed Care program. So that is something that has been a years-long process working with various stakeholders, the provider community, the legislature, the governor's office. We're to the point now where we are working really steadily towards launching. There's going to be some really cool things about this program. While managed care is not a new concept, one of the unique things that Oklahoma did is include providers in how the plans are administered. And so we're really excited to have their expertise.
When can people, you say you're close to launching, what's kind of the timeline on that?
Sure, so we have 2 different plans, dental and medical. So our dental plan will launch in February of 24 and our medical plan should launch in April of 24. So we'll start enrolling people late winter, early spring.
And I guess if viewers are watching today and they've got questions or they're wondering about kind of what y'all do and where resources are, I mean, what would kind of be your message to people watching today?
Right, absolutely. So first of all, our website has a lot of amazing resources, www.okhca.org. You can always log into your own Sooner Care account via our website as well if you are one of our members that receive Medicaid. One of the other projects that we're working on right now is the public health unwinding, and we want to be sure that we get this message out to maintain coverage for individuals that are eligible.
Okay, so that's great news there. There's plenty of resources for our viewers out there. We're going to link your website on our website as well, so people can have easy access to it. But Ellen, thanks so much for coming on today.
Absolutely.
Congratulations on this new role, and we're excited to see what you do with it.
I appreciate you being here.
So thank you.